Okay, students, the main idea from all of these examples, the pigweed, the tuberculosis, and the multi-drug resistant bacteria, is this. The environment does not cause the mutation it is selecting for. The mutation is already there in the population. That is that pre-existing assumption, right? That there has to be variation in the population already, that then the particular environmental factor is selecting for some mutations over others. Okay, so in the pigweed example, I'm just going to draw little weeds. In the pigweed example, we've got a bunch of weeds, right? But one of them happens to, or two of them, whatever, happens to have a mutation. I'm going to make it a little red one that makes it so when you spray the pesticides on the weeds, so it's already there, it already has a mutation, but the pesticides kill off all of these guys, and then this one is the one that reproduces into the next generation. And so you end up causing this growth of a resistant population. So you notice the pesticide did not cause the mutation that makes it resistant. The pesticide causes the population to start evolving towards resistance because it selects for anyone without the resistance and for the individual with the resistance. And the same idea is true of the antibiotics. So let's talk about antibiotics for a minute. So let's say you have a whole bunch of bacteria, right? So you've got this bacterial population, and they're all pretty normal, but you have one in there, or two in there, that have a mutation that makes them antibiotic resistant. So there's what you get exposed to. Okay, so let's say somebody sneezes on you, achoo. So here's somebody's nose, achoo. That's disgusting. Okay. So here's the bacteria that you get exposed to. By the time that your body realizes that there's a problem, they've grown and reproduced. Even the resistant one has grown and reproduced, right? And so you start taking the antibiotics. Well, the antibiotics are going to kill all of them that are not resistant, right? And let's say you just take them for a little bit and then you start to feel better. So you're like, oh, I don't need them anymore. Well, then you're allowing the rest of them to propagate along with the good ones and not good, but the ones that aren't resistant and the ones that are resistant, and they're growing bigger. Not only that, but these guys that are resistant, remember plasmids, they like to share their resistance genes with other bacteria. So then you're in trouble. But your immune system might be able to take care of that small population. But let's say that you then sneeze onto somebody else, and I'm going to make your nose red because when you sneeze, you're sneezing out mostly antibiotic resistant ones, okay? And then some of those other ones. And so as a consequence, in your neighbor, by the time they realize that they've been exposed, their population looks like this. Boy, they're getting more circular as we go. And so when they get exposed, now antibiotics are only going to kill off a small portion of them, and they're going to end up with this really strong antibiotic resistant strain. So not taking your antibiotics or taking antibiotics when you shouldn't, it may hurt you because it may breed this antibiotic resistant strain in you, but it more likely is going to hurt your neighbor, right? Your neighbor that you sneeze on that doesn't know they're infected until they have this huge population of antibiotic resistant bacteria. So it's a big problem, and anytime you take antibiotics, you are selecting for those that are resistant. Remember, the antibiotic is not causing the bacteria to become resistant. It was already there, but you are selecting for them and allowing them to grow bigger. So every time you take antibiotics, even if you need them, you are selecting for antibiotic resistant strains. Hopefully, again, that your immune system, you get the population down low enough that your immune system can take care of it. But if not, you're spreading antibiotic resistance. You should never take an antibiotic unless you know you need it, and then you should take it to completion. And a lot of times doctors just prescribe them to be prophylactic, or they prescribe them because the patient is demanding it. So don't be one of those patients that demand antibiotics. And when you get them, take them to completion. So that's what you should have learned from this activity.